Today, let's talk about counseling for family planning. Learning objectives. At the end of the session, you will be able to identify benefits of effective family planning counseling, to discuss general principles of counseling for family planning, to describe the context in which counseling can take place, to describe the special nature and steps of family planning counseling, to discuss the factors influencing family planning counseling outcomes. Introduction. The primary objective of counseling in family planning is to decide the number of children the couple wish to have and when to have those children. Also to choose a contraceptive method that is personally and medically appropriate. To understand how to use the chosen method correctly and ensure safe and effective contraceptive protection. As a definition, counseling is a face-to-face communication with your client or couple in order to help them arrive at a voluntary and informed decision, which is different from advice, in which you try to resolve a client's problem by giving your personal opinion. A counseling is a continuous process that you as a counselor provide to help clients make and arrive at informed decision about use of contraception. Informed choice is a voluntary choice or decision based on the knowledge of all relevant available information. In order to allow people to make an informed choice about family planning, you must make them aware of all the available methods, and you must know advantage and the disadvantage of each method. You must know how to use the chosen method safely and effectively, and also you must know the possible side effects. Approaches for different types of family planning counseling. We have an individual counseling, couple counseling, and group counseling. Individual counseling is a process through which clients work one-on-one with the counselor. You must, as a counselor, respect the need and interest of a client by finding a private room, place where you can talk with them. You must maintain privacy and confidentiality for the client during counseling. Couple counseling. A couple counseling is when you give a counseling service to a couple or partners together. You must understand and support for all methods, especially those that concern both partners, like irreversible family planning measures such as voluntary surgical methods, barrier methods, natural family planning, and side effects. Group counseling. When there are people who are more comfortable in a group or before an individual counseling, you must give a group counseling. Greet everyone in different manner, give an overview, explain the benefits of family planning. You must discuss common misconceptions about family planning, inform to your client how to obtain appropriate contraception. You must have education materials. You must also be able to answer general questions. People are not likely to share their more personal concern with you in this setting, and at that time, encourage them to think about their needs and seek individual counseling. Let's talk about the benefit of family planning counseling. Many benefits of family planning counseling. It increases acceptance of family planning services. It promotes effective use of family planning services. Increase client satisfaction with family planning methods and services. Enhance continuation of family planning services, and also dismiss rumors and correct misunderstandings about contraceptive methods. Principles of counseling in family planning. General principle of a counseling. A counselor must respect the dignity of others, must respect the client concern and idea, must not be judgmental and must be open, must show that you are being an active listener, you must be a listener, must be empathic and caring, must also be honest and sensitive. The special nature of family planning counseling. Many people have strong idea about family planning, some based on misconception. You must try to find out your client's view by encouraging them to talk. You must be respectful when sharing idea and demonstrate understanding of their values. Do not ask them judgmental questions such as, are you one of those people who believe that modern family planning is forbidden for the young people? Such questions sound critical and can make people feel inferior or may make them mistrust you because they must ask themselves, why should I believe this person when all my relatives share my beliefs? Understand, be sensitive to culture and psychological factors that may affect clients in adopting and using family planning methods. Some methods may be unpopular with clients. For example, a woman may not like the idea of having to insert a contraceptive into her body before having sex, or a man may think that a condom will take away from the pleasure of sex. Context in which counseling can take place. General counseling. Describe a wide variety of relevant methods and clear up any misconception about specific family planning methods. Talk about sexual and reproductive health issues like sexual transmitted infection, HIV/AIDS, and infertility. Give more information about the chosen method. Explain the examination for fertility screening. Instruct on how and when to use the method and tell the client when to return for the follow-up. At the end, ask the client to repeat what you have said on the key information in order to be sure that they all catch your information very well. There are many approaches that are used in counseling and family planning. Let's talk about Gather approach. It is framework for providing competent caring counseling in family planning, where G means greet the client respectfully, A means ask them about their family planning needs, T means tell them about different contraceptive options and methods, H means help them to make decision about choice of methods, A explain, demonstrate, and how to use the methods, R means return, means where schedule and carry out return visit and follow-up. Let's go in deeply how we use that approach. On G, which is mean greet the client, you greet them in a respectful manner and introduce yourself after offering the seats. Give your full attention to your client. Ask them how you can help them and assure confidentiality. Explain what will happen during the visit. Describe physical examination and laboratory test if it is necessary. Make sure there is privacy. A, ask the client about themselves. Help them to talk about their needs, doubts, concern, and any question they may have. If they are new, use a standard checklist for biodata and history, means identification, and also take history, general history, family history, obstetrical history, gynecological history. Ask them specific questions about medical conditions. If you have seen the client before, ask if there is anything has changed since the last visit. T. Tell them all about family planning methods. Tell them which methods are available in your service. Ask which method interests them and what they know about the methods. Briefly describe each method of interest and explain how it works, its advantage and disadvantage, and the possible side effects. H. Help them to choose a method. To help to choose the best method and the safe method of contraception, ask them about their plan and family situation. Ask if there is anything they cannot understand and repeat information when necessary. Check whether they have made a clear decision and specifically ask, what method have you decided to use? E. Explain how to use a method. After a method has been chosen, give supplies if appropriate. If the method cannot be given immediately, explain how, when, and where it will be provided. Explain how to use the method. Ask the client to repeat the instructions. Describe any possible side effects and warning signs and tell them when to do if the sign warning occurs. Ask them to repeat this information back to you and give them printed material about the method to take home if is available. R. Appoint return visit for follow-up. Tell them when to come back, follow-up visit, and to come back sooner if they wish, or if side effects or warning signs occur. At the follow-up visit, ask the client if she is or they are still using the method and whether there have been any problem. Ask if they have been see any side effects, and also ask about the family planning goal if the goal have been changed. Reassure the client concerning minor side effects and explaining that the side effects are not dangerous and suggest what can be done to relieve them. Refer for treatment in case of severe side effects and ask the client if they have any other questions. Another approach to use is called BRAIDED. The first was gather and this one is BRAIDED. BRAIDED is acronym which can help you remember what to talk about when you counsel a client on specific method. It is standard for benefits of the methods, risk the method including consequence of method failure. A means alternative to the method including abstinence and no methods. I means inquiry about the method, individual right and responsibility to ask. D means decision to withdraw from using the method without problem. E, explanation of the chosen method, and D, documentation of the session for your own records. Return follow-up counseling should always be arranged. You must discuss and manage any problem and side effects which is related to the given contraceptive method. You must encourage to continue use of the chosen method unless problem exists. You must determine any other client concern and questions. Factors influencing family planning counseling outcome. There are 3 factors which may influencing family planning outcome. The one may be come from the counselor, the second may be come from to the client, and the third is external pragmatic factors. 1. Factors related to the counselor. It may come from effective communication and skills of a counselor, clinical knowledge of a counselor, and attitude, belief, and the value of a counselor. Sometimes you will be communicating with someone who differs from you in terms of the social status, gender, or education, and that will affect counseling process when you have low self-esteem. Factors related to the client may be knowledge and level of understanding of the client, how they trust the counselor, values, beliefs, and the culture of client, medical and social condition of client, and also life change may affect the outcome of the counseling. External or pragmatic factors which may affect the outcome of counseling. Access to reproductive health services in general and the family planning program in particular. Methods, availability, socio-economic and socio-political circumstances, clinical capacity and healthcare infrastructure, and healthcare human resources may affect the outcome of the counseling in family planning. As a summary, we have discussed many things in this session, as family planning counseling definition, which is the process to help decide to the number of children they wish and when to have their children. We have discussed different ways of providing effective family planning counseling. You may work with individual, couple, or group. Also, we discussed the use of approach in family planning, who help to remember what to say when you counsel a client on a specific method. We talk about BRAIDED and gather approaches. Also, we discussed the follow-up counseling, which is given to discuss and manage any problem or side effects, and to discuss alternative of original method which has not been satisfactory. Thank you very much.